Dalhart ISD could have a case of measles in the district. According to a letter from the Dalhart Superintendent Jeff Bird, it could be as late as next Monday before they have the test results confirming the case. The district says their #1 priority is the safety of staff and students, and they will continue to monitor the situation and communicate what they can when they can. With the Texas Department of State Health Services now reporting 124 cases of measles and 1 death of a school-aged child in the South Plains, Amarillo health officials are sharing ways to prevent measles and how they are preparing for a potential outbreak. When it comes to measles, the best way to prevent the highly contagious virus is vaccination.
If someone contracts measles, if those around them are susceptible, they can infect between 9 and 10 individuals, and so that's why that protection, that vaccination, is so very important. The MMR vaccine is about 97% effective, and so it's one of the very best vaccines that we have.
Stoughton shared there are currently no measles cases in Potter or Randall counties, but APH is working with local healthcare providers to be prepared.
We're working on things like coordinating testing, making sure that our providers are able to test for the measles, that we have a system in place to get labs to either commercial labs or down to the state lab for testing. We want to make sure that measles vaccinations are available.
Stoughton says for herd immunity to be effective in the community, about 95% of the community has to be vaccinated. Associate Professor of Pediatrics at Texas Tech University Health Sciences Center, Dr. Amanda Griffin, says there is no shortage of vaccines.
You can protect yourself and your community from the measles by being sure that you're vaccinated. The good news is we don't have any shortage of the vaccine at this point. There are lots of doctors' offices that have the vaccine, pharmacies, the health department, so we haven't seen any shortages at this point.
Griffin says if you're sick, stay home, and if you have to travel somewhere that is having a measles outbreak, the best way to protect yourself is getting vaccinated.
If you're vaccinated, you have a high level of protection from getting the measles. Also, staying away from sick people is important as well. Now, if you think you've been exposed to someone with the measles and haven't been vaccinated, we do recommend you get the vaccine within 72 hours of being exposed.
Stoughton and Griffin say if you suspect you have measles, contact your healthcare provider and health department before going into your appointment so they can make proper accommodations, as measles are highly contagious and can stay in the air up to 2 hours after an infected individual has left the space. To learn more about how to prevent measles and what symptoms to look out for, go to myhighplains.com.